My name is Professor Heilbronn and I'm a researcher at Adelaide University, based here in the SAMRI building with a nutrition and metabolism theme. I'm a group leader here at SAMRI for the Obesity and Metabolism Lab, and we study obesity, but how changes in metabolism occur with obesity at the whole body level, but also in fat cells and in muscle cells. At the moment, we're particularly interested in how fasting, or changing when we eat, changes our metabolism and how that can improve our health in overweight individuals. We've just finished a study looking at about 100 women, and they come into the clinic here in SAMRI, and we measure lots of different things for them, but their metabolism, and we get them to either fast for periods of time, so 24-hour fasting periods over 2 days a week or 2 or 3 days a week for 8 weeks, and we have a look at how their body is improving with these fasting diets, or whether the weight loss diets, traditional weight loss diets with daily reductions in energy intake are better for their health. The things we're kind of interested in looking at with their health is their diabetes risk, so we have a look at how their body improves for insulin sensitivity. So insulin is that hormone that's released from your pancreas when you eat food, and in overweight people that doesn't work very well. So lots of insulin is released, but that hormone really doesn't work very well, and so we're looking at how we can improve the action of that hormone. We're interested in whether fasting, which is something where you do it for a specific period of time, but you get a number of days per week where you can eat to satiation, so you don't have to diet every day. And it's been shown that people can do okay losing weight, and they do okay with reducing their energy intakes for short periods of time, but long term it really is really hard. Your body fights against you. You have changes in your gut hormones that make you feel hungry. You have changes in your metabolism that mean that it's harder and harder to keep that weight off because your metabolism reduces. And so we're interested in whether, if you can do it for some days per week, but you can eat on other days per week, is that an easier diet to maintain long term? We have short-term data at the moment that suggests that the fasting diets are slightly better for weight loss short-term, like 8 weeks. Our ladies lost a little bit more weight on the fasting diets than they did in those daily caloric restriction diets. So perhaps they found them a little bit easy to stick to over that time period. And we also saw that there was a bit bigger reductions in that insulin level in the fasting diets compared to the calorie restriction diets. So at this stage, at least short-term, we're showing that fasting diets are at least as good, if not better, than a traditional daily calorie restriction diet. The obesity epidemic, it's really large at the moment. 60% of the Australian population is classified as either overweight and obese, and that really increases health risks for many diseases: diabetes, cardiovascular disease, even some types of cancers. So we really have to be working hard to reverse that epidemic that's overcoming Australia and the world.